Today, we're going to talk about something that's incredibly common, but also, let's be honest, pretty misunderstood. We're diving into the microscopic ecosystem inside our bodies, a world where a delicate balance is literally everything. Let's get into it.
Okay, just look at this number. 3 out of 4.
Yep, that's how many people with a vagina will get a yeast infection at some point. It's one of the top reasons people go see a doctor. So it's an almost universal experience, but what's actually going on in there can feel like a total mystery.
So let's answer those questions, right? To really get what happens when things go wrong, we first have to understand the beautifully complex system that's working when everything is going right. You've got to think of it not just as a part of the body, but as its own thriving, self-regulating environment, a truly delicate ecosystem. So, the vagina is actually home to this bustling community of hundreds of different kinds of tiny microorganisms. This is what we call the vaginal microbiome, and its entire job is to work together in harmony to keep things healthy.
Now this is cool. Think of this like a story with two main characters. Over on the left, you've got the guardians. These are the heroes, lactobacillus bacteria. Their job is to produce acid, which keeps the vaginal pH low and creates an environment where nasty microbes just can't grow. And on the right, you have the resident, a yeast called Candida. Now, it's almost always there, just hanging out in small, harmless amounts, because the immune system and those guardian lactobacilli keep it in check.
But what happens when that careful balance gets thrown off? Well, that's when we hit the tipping point.
And the microorganism behind most of these infections is a specific species called Candida albicans, and it's kind of a shapeshifter, which, as you'll see, is totally key to how an infection starts.
So here's exactly how it goes down. First, the balance gets disrupted. Maybe the pH goes up, or the good bacteria take a hit. This is Candida's big chance. It actually transforms, it shapeshifts from its normal round shape into these long, thread-like things called hyphae. These threads then invade the vaginal tissue. And in response, your immune system sounds the alarm, rushing cells to the area and causing inflammation.
And that inflammation is what causes all those familiar, super uncomfortable symptoms. The itching, the burning, the swelling, the redness. It's all a direct result of your body's immune system fighting back. The change in discharge, that's also part of this response, as the body is trying to flush out that overgrown candida.
So this all begs the question, right? What knocks that ecosystem off balance in the first place? Let's take a look at the common triggers, or as we're calling them, the disruptors.
You know, some of the biggest disruptors are medical. Antibiotics, for example, are lifesavers, but they're not very precise. They can wipe out the good lactobacilli right along with the bad bacteria, basically leaving an open field for Candida to just take over. And if your immune system is compromised, maybe from an illness or medication, it might not be strong enough to keep that yeast population under control. Our own biology and what we eat can play a part too. Hormonal shifts, like the ones that happen during a menstrual cycle or pregnancy, can change the whole vaginal environment. And get this, even semen, which is less acidic than the vagina, can temporarily raise the pH just enough to give Candida an advantage. And then, of course, you have lifestyle and hygiene factors. Things like wearing tight, non-breathable clothing can trap moisture, which is basically the perfect environment for yeast to thrive. Some harsh soaps can damage the protective mucus lining. And yeah, something as simple as wiping technique really matters. Wiping from back to front can unfortunately introduce all sorts of unwanted microbes into the mix.
Okay, so that's how the balance gets lost. But the good news is, our bodies and modern medicine are actually pretty darn good at fighting back and restoring order.
The standard treatment is antifungal medication. And it's important to get how these work. They're not trying to completely eliminate the yeast. Their goal is just to knock back the number of Candida cells, like, way down. This gives the immune system and the good bacteria the breathing room they need to regain control and bring that ecosystem back into balance.
But here's where it gets really fascinating. There's some preliminary research that's looking into a kind of fight fire with fire approach. Some studies are suggesting that using probiotics that contain harmless yeasts, the same kind used in baking, could actually help keep Candida in check and cut down on inflammation. How wild is that?
But for about 5 to 10% of people with vaginas, this is a recurring battle. We're talking 4 or more infections a year. For some, the cause is genetic, which just makes it harder for their immune systems to manage Candida. But for many others, the reason they keep getting them is frustratingly unclear.
And that frustrating lack of answers for so many people, well, it points to a much bigger picture. The reality is, this entire field is a seriously under-researched topic. The simple fact is, we just don't know nearly enough about the vaginal microbiome, and this huge knowledge gap is mostly because of historical stigma and a chronic lack of funding for anything that falls under the umbrella of women's health.
This graph right here shows the disparity in a really stark way. Even though yeast infections affect a way bigger chunk of the population, research shows there are about 6 times more studies on erectile dysfunction. Now look, this isn't about judging which condition is more important, it's just a clear look at where research priorities and funding have been going for a very long time.
So we're left with this. Our bodies are these incredibly complex ecosystems. Understanding what causes an imbalance is the first step for sure. But the bigger challenge leads us to this final, really vital question. How can we better understand the multitudes we all contain inside of us? And how can we learn to best keep them in balance?